Today, I rise to strongly support the passage of the Support for Patients and Communities Act. The Support Act, actually, I think that's a great title, the Support Act. The Support Act combines the work of the House of Representatives with the Senate's Opioid Crisis Response Act, which we recently passed with overwhelming bipartisan support. As we anticipate voting on this groundbreaking legislation soon and sending it to the President's desk, I wanted to highlight some of the provisions that I think are most critical, many of which I worked with my colleagues on the other side of the aisle to move forward. The Support Act successfully builds on the work Congress began with the passage of the Comprehensive Addiction and Recovery Act back in July of 2016. And it is a critical next step in our fight against an epidemic that continues to devastate families and communities across this country, especially in my home state of West Virginia. This legislation reflects what we've learned in the past few years since we passed CARA. West Virginia has just been struggling so much with the opioid crisis. We've been struggling longer and harder than many of our other states. This is not something we're particularly proud of, but it's a reality which we live, and we really face the challenge. This crisis has shaped our ongoing response to the epidemic, as well as my contributions to the bill. In West Virginia, we understand better, I think, some of the causes of the crisis and how we can then deal with them. We've discovered what's working in our state, and we've learned that the ripple effects go far beyond those struggling with addiction. It affects families and children and communities. When thinking about next steps for fighting the opioid epidemic, one of the first things I realized was that the formula for state funding was not providing adequate resources to the hardest hit states like West Virginia. I joined with my colleague, Senator Shaheen from New Hampshire. Her state also has been devastated by this epidemic to help work in changing that formula. I'm pleased that this bill reauthorizes the state grants in a way that ensures that states like ours, small states with very large problems, will begin to receive more resources, and those resources that we desperately need. Something else we quickly realized in West Virginia was we didn't have the treatment facilities or the trained workforce to adequately support individuals seeking treatment. To address these needs, I worked with my colleague, Senator Hassan from New Hampshire, to create a grant program establishing comprehensive opioid recovery centers, or CORCs, in the most affected areas. And I worked on provisions that will help increase and better prepare our healthcare workers. We also realized, sadly, that there will always be bad actors who attempt to take advantage of those in crisis. I talked to friends of mine whose young adult children are in the throes of addiction, who will literally pay anything to get the help they feel their loved one deserves, particularly making them particularly vulnerable, I think, to bad actors and to folks that might take advantage of that. So we introduced the Opioid Addiction Recovery Fraud Prevention Act with Senator Cortez Masto from Nevada. This measure will hold fraudulent substance abuse treatment programs and recovery centers accountable by empowering the FTC to bring enforcement actions against them. Another issue I hear about often is the need among employers for potential employees who are able to pass a drug test. Our economy's booming. Our workforce is expanding, but we're having difficulty in some areas finding enough employees that can actually pass a drug test. It's not unusual. I'll hear 10 people get tested and only 2 will pass. And so we have that need also for them, for recovering addicts, to be able to find that pathway back to employment. To address both of these needs, this legislation authorizes grants that will align job training and treatment services, including several provisions from the CARE Act that I sponsored with Senator Brown from Ohio. As to the causes of the crisis, there are many, but there are 2 areas that come up again and again. First is the need to reduce the number of prescriptions for opioids. To get at the root of the problem, Senator Feinstein and I introduced the Using Data to Prevent Opioid Diversion Act. Our bill, which is now a part of this support act, provides drug manufacturers and distributors with data to identify pharmacies that are suspiciously ordering prescription opioids. And it grants law enforcement the authority to hold them accountable, as they should be, if they fail to use this data, identify, report, and stop suspicious orders. Had something like this been on the books before, we may have been able to stop, and I want you to hear this statistic, the 780 million oxycodone and hydrocodone pills that were distributed to pharmacies in my state alone, my 1 million population state, between the years of 2007 and 2012. 780 million pills, including the nearly 9 million pills that were distributed between 2007 and 2008 to a single pharmacy in Kermit, West Virginia, where the population is 392. The second issue that comes up often is the need to reduce the amount of synthetic opioids like fentanyl, which is killing people, which is 100 times more potent than heroin. The STOP Act, which will help prevent the shipment of synthetic opioids into the United States through the international mail system, where the vast amount of these originate. This measure, which Senator Portman led and I joined with him to introduce, imposes tough new requirements for our U.S. postal system and Customs and Border Protection. By better targeting illegal packages, we can keep those dangerous drugs from ending up on our streets and in our local communities. West Virginia has a more mature opioid epidemic. That has helped us to learn what is working and what is not working. One great example of something that is working is our quick response teams, our QRTs, which has been piloted in Huntington, West Virginia. Based on similar programs around the country, a QRT is a three-pronged effort by medical professionals, mental health agencies, and law enforcement. These teams contact individuals who overdose within 72 hours of their overdose to help get them into treatment programs. In other words, let's just not have them come into the emergency room, stop the overdose, and have them walk back out with no follow-up. These quick response teams, given the success of the QRTs in our state, I worked with Senator Murphy to include a grant program in the Support Act that will allow communities across the country to implement similar programs. When it comes to what is not working, over the last year or so, I began to hear from hospice staff who, due to a DEA rule, I seriously didn't understand this rule, were not allowed to destroy unused medication unless authorized by state law. That, a lot of times in hospice, particularly with elderly people in hospice, or anybody who's in a great deal of pain, has medications on the shelf. And if it's left to the disposal of a family member, you could see how it's just ripe for falling into the wrong hands of a grieving family member or possibly somebody in and out of the home who has an addiction issue. So I worked with Senator Collins to ensure the Support Act includes language that would allow hospice employees to dispose of those controlled substances. Another example of a policy that's not working is a 40-year-old regulation related to substance use disorder privacy records. This came to my attention following a terrible tragedy of my fellow West Virginian Jesse Grubb, which was caused by confusion and misinformation. Jessie was a daughter, a great sister, an athlete, and someone who was recovering from addiction. Following surgery from a running injury, despite her family and her best efforts to make it clear she was not to be prescribed opioids, she was discharged from the hospital with a prescription for 50 oxycodone pills. Jessie overdosed on those pills. She was 30 years old. Following her tragic death, Senator Manchin and I introduced Jessie's Law. Jessie's Law makes it easier for doctors to know if a patient has a history of opioid abuse. It requires HHS to develop best practices for prominently displaying this information in electronic health records when requested by the patient, so they can see right there as they're discharging this patient. Although Jesse's Law passed the Senate in August, it had not passed the House, and I'm glad to see it's in the Support Act. Still, while this may help avert future tragedies, many in the addiction community have encouraged further action to assure providers can safely and effectively coordinate high-quality treatments for patients with substance abuse disorder. To meet those needs, Senator Manchin and I introduced Protecting Jesse Grubb's Legacy. Part 2 is not in the Support Act, and we will continue to work on this Legacy Act to make sure that this important policy change happens. Something we've seen in West Virginia are the ripple effects of the opioid. These are the children, the families, an unbelievably increasing number of children who are being raised by their grandparents, raised by their great-grandparents, or in foster care. And it's putting a major strain on our social services, but on that individual child who, through no fault of their own, is ping-ponged from house to house in very emotional kinds of ways. There are more babies receiving neonatal care, and I work with my colleagues to make sure that the CRIB Act is, that I worked on with Senator Brown as well. This measure clarifies states' ability under Medicaid to provide care for infants with neonatal abstinence syndrome in residential pediatric recovery centers like Lily's Place that we have in Huntington, West Virginia. The First Lady actually visited Lily's Place, and we welcome her to come back. We also reauthorized residential treatment for pregnant and postpartum women, a grant program I worked with my former colleague, Senator Ayotte, to include in CARA. This provides new resources to identify, prevent, and mitigate the effects of trauma related to the opioid epidemic on infants, children, and their family. If nothing is done with the generation and the ripple effect of children, I fear we're at real risk of losing not just one generation to opioids, but the next generation as well. Fortunately, there are lots of things that are being done. I'll mention one, the Martinsburg Initiative in West Virginia, which is a combination between Shepherd's University, the Martinsburg Police Department, and the Berkeley County Schools, as well as the Boys and Girls Clubs of the Eastern Panhandle, working together as a combination to work based on a CDC study that shows when children have adverse childhood experiences, like exposure to drugs and alcohol, it can have a major impact on their physical and mental development. When we started CARA 2 years ago, I said it's a good start, and this is the Support Act is a great next step. A lot of this has to do with funding. The Defense Labor Conference report that the President signed into law last week includes $3.8 billion for the opioid epidemic, an increase of $206 million. With this year's funding for a related program has increased by more than $3.5 billion over 4 years. So clearly we have a commitment to this as a body, as all of us working together. I would like to applaud the effort of all the committees involved, and especially the dedication of the HELP Committee, Chairman Alexander, and his staff, and those who worked together. I look forward to continuing my work with my colleagues to work on ongoing and emerging problems in this space. Methamphetamine is something that is way on the rise and taking over. Unfortunately, taking over from heroin, which is just a terrific tragedy. There's no one silver bullet when it comes to the epidemic of opioids, but one thing is for certain: I and we will keep fighting. We will fight back against those who are bringing deadly drugs into our communities. We will fight for those struggling with addiction and seeking treatment. We will fight for the children who are caught in the middle, and we'll fight for every other person who is affected by this crisis. I'm going to keep fighting for states like mine that even in the darkest hours of our darkest hours in West Virginia with this crisis, we've continued to move forward to a better. Overdoses are down in Huntington, West Virginia by 41% because of the community effort. That's a brighter, drug-free future that we're all fighting for. Mr. President, I yield the floor.